You recently bought a health insurance plan in the individual market and said to yourself, man, I can't remember the last time I saw a doctor or had a checkup. I'm turning 40 in a month and I got all these aches. Why am I always tired after every meal? I can't hang with my 4-year-old. I just have no energy. I think I should use this plan and get a checkup. And you do just that. You see your local doctor, he checks your vitals, checks your blood pressure, you cough twice as he examines your jingle bells, you get labs done, do blood work, pee in a cup, give 2 vials of blood to the phlebotomist, and you go home. A day later, the lab results have been uploaded onto your patient portal and you find out that your 40-year-old ass has hypertension, high cholesterol, gout, and you are borderline diabetic. Yay you. 3 weeks later, you get a medical bill for $500 and you ask yourself, how the fuck did this happen? I thought my health insurance plan covers free annual checkups. Let me explain. But before I do, if you don't know who I am, my name is Mark, aka Health Insurance Mark, or him. I'm an active health insurance broker licensed in 20 different US states. I've been shopping health insurance plans to thousands of individuals, families, small businesses for over a decade now. My career to date annualized volume is over $9.6 million in health insurance premium alone. I make these videos so that I can help as many people as I can navigate through this overwhelming clusterfuck of misinformation that we call the American healthcare system. Let's dive right in. So why is it that your current health insurance plan that you just bought not cover your doctor visit that you just got done, as well as your blood works and cholesterol screenings and whatever else you got done recently? Well, that all depends on what you purchased. Let's say we use ehealth.com, we use an individual family, type in your zip code, and if you purchase an Obamacare Affordable Care Act plan or ACA plan, all of these major medical health insurance options should cover free preventative wellness visits. I'm going to go over in detail in a bit what is covered here. But sometimes people buy less expensive plans like the short-term plans or non-Obamacare major medical plans. I'm going to go explain this part first. Let's say you purchased one of these non-Obamacare plans recently. And out of these health insurance options available, you selected United Healthcare. You don't want to go by what it shows on the website listing because sometimes there are errors on the website. What you want to adhere to or go by is the actual PDF that is composed by the health insurance company. You want to keep scrolling for more details. Click on Plan Brochure PDF. This has it all. It should be the be-all, end-all. You bought a short-term plan, and out of the 4 different product options that United Healthcare offers, you got a copay, which is expensive. Then you got these Premier, Plus, and Value. You look at the preventative care row right here. You pay 20%. So if the annual checkup was $100, you only paid 20% or $20. But it says after the deductible. The cheapest deductible, the lowest deductible is $2,500. An annual checkup to the doctor can range anywhere from like $200 to $600, really, nationwide. You're not going to reach your $2,500 deductible once a year. This plan right here has no charge. This is 20%, this is 30%, but they all say after the deductible has been met. And your deductible can be as low as $2,500. So you will be pissed when you buy one of these non-Obamacare short-term major medical plans and realize that your annual checkup was not covered. If you are a woman and you bought this plan, your PAPs are heavily discounted in certain states. Your mammograms are free so long as you're over 45. So there are certain stipulations. You must look at the exclusions on the back of this PDF brochure, not just by the website. Because every state in our wonderful country has different stipulations. There's different exclusions for states of Alabama, Arizona, Arkansas, Illinois, etc. So you want to make sure you know what is excluded. That is the non-Obamacare short-term space. Now there's the other market, which is the Obamacare market or the Affordable Care Act. And I'm not going to use eHealth because I don't like it. I like to use Health Sherpa for Obamacare options. It's really simple. It's easier to navigate on this website. Plug in zip code, household members, how many people you file in your taxes, and your age. You're going to observe that these are all the health insurance companies available in my area. And between the PPO and the HMO, you want to collect PPO. because you have better access to more top doctors in hospitals and lab facilities than an HMO. HMOs are generally cheaper. But if I click off on PPO, the cheapest premium is $416. It's got a high $9,000 deductible right here. You want to click on plan details and scroll down to doctor visits. If I'm sick and I got a boo-boo, it's going to be full price for that visit. If I have to see a specialist, it's going to be full price as well. But for preventative visit, which is what this video is about, it is no charge. But how do you know what is no charge? You're not going to find it on this particular website, which is why you have to go by the actual summary of benefits. So summary of benefits, provider list. Preventative care screenings, still no charge after your deductible. I'm sorry, still no charge and your deductible does not apply. You may have to pay for services that aren't prevented. Ask your provider to serve, then you check what your plan will pay for. So actually what you got to go by is go to healthcare.gov to figure out what is covered. In the search bar, type in preventative. And you want to click on this first link right here. On this PDF coming from this particular Blue Cross Blue Shield plan, it really doesn't disclose a listing of all the things that are covered. So you want to go to healthcare.gov and click on either for adults or women or children, but click on for adults. As you can see here, from number 1 all the way down to like number 22, this is a listing of all the free screenings that are complimentary to your major medical expensive Obamacare plan. In the box it says right here, these services are free only when delivered by a doctor that's in your network. That is one of the stipulations. 11 years ago, when I was a youthful 29-year-old lad, I had a cholesterol screening done. I definitely made sure that the lab facility was in the network because I didn't want to pay anything out of pocket because I was 29 and poor. So I'm still poor. But cholesterol screenings, all right, 24 hours later, I found out that I had high cholesterol. I was subject to a medical bill for $300 a couple of weeks later. I was pissed because my results were not normal. There should be a second sentence on this particular website that says, and also, if your results are normal / healthy, you don't pay for anything. That wasn't the case for me. So I definitely was not going to forget that situation. This particular website hasn't changed in over 11 years. It's still the same font, same everything. So if you have a major medical Obamacare plan and you went in for a cholesterol screening or a colonoscopy, you got to be between 45 to 75 to get it free. But after your colonoscopy, you find out that you have colorectal cancer. Guess what? Your colonoscopy is not going to be free. You're going to be paying for that colonoscopy out of pocket. HIV screenings, immunizations, hepatitis B screening, all of these are free so long as your results are normal / healthy. I wish it would say that right here versus me or you finding out the hard way when you go in for your annual checkup. I'm going to link this particular website in the description below for your information, but hope this makes sense. It depends. Your annual checkups are free depending on what kind of health insurance plan you purchase, whether it's an Obamacare, Affordable Care Plan, or a short-term plan. If you have questions regarding this, just send me a DM or email me. Otherwise, I'll see you in the next video. Click this video right here if you recently quit your 9-to-5 and started your own entrepreneurial journey and became a solopreneur starting your own YouTube channel as well. This will help you guide you as to how to shop for health insurance on your own. Not group health insurance plans, that's through your employer, but this video shows you how to shop for health insurance plans on your own. I'll see you there.